Okay, let's talk about internuclear ophthalmoplegia. Now, this internuclear means that there is a problem in between nuclei. What nuclei are we talking about here? Brainstem nuclei that we studied. Two of them. I will tell later. Ophthalmoplegia, ophthalmo-eye plegia paralysis or weakening, whatever. So your eye will stop. Eye paralysis, which is caused due to an internuclear. Between two nuclei, some connection problem is there, which is causing your ophthalmoplegia. This is a horizontal eye movement problem, horizontal gaze palsy. Why? Because horizontally, if you look in this direction, right or left, then only you will get this ophthalmoplegia. Now, here I will start by telling you how when the brain, when your cortex or whatever is trying to think, ki, I want to look here and there, I want to look right and left. You think and then you do. So when you think till how you do, I will explain the connection. Here you have your brain. In Brodmann's area 8, it is thinking, ki, I want to look in the horizontal plane here or there laterally. Lateral gaze we will talk about first. Just this. Now, if you want to look laterally, what for your eyes, imagine this is your right eye, this is your left eye. Imagine that this is your head and you are taking a plane like this and then you are looking from this side and your eyes are, you flip this image, you will see this thing, you imagine this. Okay. This is your right eye, this is your left eye. Now, lateral gaze. Laterals are these sides are lateral. Here it is medial. So here is lateral. So if you want to look laterally, what will happen? I will tell you. Your brain will think that you want to go laterally. Then it will relay its neural information to a structure called the PPRF. Here you have a problem. You go here, you go here. It will tell the contralateral PPRF to now go and do its thing. So this is something you have to remember if you are trying to study like PPRF problems or brain problems that can cause these horizontal pulses. So now your brain is thinking, ki, I want to look laterally. I want to look this side. So information will go to the PPRF level. The PPRF will go and relay onto the cranial nerve 6, which is the abducens nerve. It innervates your lateral rectus to look laterally. So LR6, LR6. So this is thinking ki chalo, let's look laterally. PPRF will be like, okay, fine. Brain told me to look laterally, so I will tell the brainstem to look laterally. So which nucleus it has to tell? Abducens nucleus. Okay. Now the abducens nuclei will obviously the right one will innervate the right lateral rectus and it will tell the right eye to look laterally in this direction. The left one will also do the same and tell the lateral rectus to look laterally. Now, say your brain as a whole, you are one person, you don't want your right eye to look here and your left eye to look here at the same time, no? If you want to look towards your right side in your view, your right eye will move like this, your left eye will move like this. The right eye is turning laterally. So LR6 is happening, yeah, very good. But your left eye will have to turn medially. Now, if the brain said ki will try to move lateral, both the PPRFs will tell both the cranial nerve 6 to move laterally. That cannot be because this will look here, this will look here. So if you because and your brain obviously does not want to look in your eyes to diverge also. They want to look in the same side of your vision. So say for example, we want to look to the right side. So this will like this area of the brain will send it here, it will send it to the cranial nerve 6. The cranial nerve 6 will directly innervate lateral rectus. Very good. Now, it has to somehow innervate the medial rectus of the other eye, left eye, to also look towards this area, no? So, there is a connection here also. Your, your one side's cranial nerve 6 will connect to the cranial nerve 3 of the contralateral opposite side to tell it to, हाँ चलो, needle rectus, you move to the right side because I want to see right. So this nucleus only is doing the LR6 here and the medial rectus here, so that this moves here, and both look in this direction. This is how it happens. Now, one famous thing that we studied in anatomy is, and that we always see in the brain stem cross sections, is the medial longitudinal fasciculus. This this MLF, medial longitudinal fasciculus, carries your internuclear fibers. Then, what is the problem again? Here also it was going crossing over. Here also it is crossing over. That's the thing. That this crossing over will also come in handy if you do like try to study lesions at every level, not just MLF, which is the what we are going to discuss in this video, internuclear ophthalmoplegia. Okay, so this was basically how it works. Now, say for example, some left problem is there. Hmm? Left MLF syndrome or whatever, something is causing damage to the left medial longitudinal fasciculus. Okay, so this is what we are considering. Now, say your eye wants to look in the left direction. Your brain wants your eye to look in the left direction. So the right Broca's 8 area will tell the left PPRF कि हाँ चलो you start this thing and you start this thing. Is there a problem here? Problem is here, but there was no problem here, no. So this LR6 will happen. This MR3 will happen. It will look laterally. Very good. Now, lateral to the left. Now, if your brain thinks, yeah, chalo, time to look in the rightwards direction, then the left side is saying, ha, chalo, let's look in the right direction. This will come here, this will come here, this will come here. Your right eye will look in the right. Very good. That's a good thing. Your right eye will look in the right. But now let us imagine your left eye. Hmm? That's the problem. This happens to look here, but this cannot happen. So your left eye cannot look medially now. So your eye will not be able to look. So if say you are looking at the patient's eyes from the sorry, that looks like funny shit. Okay, say this is your patient and this is right, this is left. But telling the patient, ha, look right. It will look here, but it cannot look. So this horizontal problem you will get. So a left MLF lesion will cause a left internuclear. What are the two nuclei? 6, 3. Left internuclear ophthalmoplegia. Where left, where what? The wait, left eye stops when trying to look in which direction? Right. So again, crossing, there was a crossing over here, there was a crossing over here, and there's a crossing over here also. The left lesion will cause, and we name it as a left internuclear ophthalmoplegia because internuclear fibers causing an ophthalmoplegia of the left eye. See, this right eye is not the problem. This left eye stopping was the problem, no? So left eye has a problem. So left internuclear ophthalmoplegia. Why is it happening? Luckily, because of a left lesion only. It's not कि हाँ right lesion को दूसरा. But when the eye tries to look in the right direction, the left will stop. So what is stopping? Where the problem is, left will stop. So left is the problem, no? So left internuclear ophthalmoplegia like that. Thank you.